So Chapter 11 covers healthcare fraud and abuse. Chapter is, I think it's well laid out, pretty self-explanatory. You're going to see and read a lot about Medicaid, Medicare. The Office of Inspector General, also known as the IOG, is mentioned throughout this chapter. So we can just start with what is Medicare fraud. And Medicare defines fraud as an occurrence where someone intentionally falsifies information or deceives Medicare. I can tell you whether it is intentional or non-intentional. If you commit fraud, you will be fined, imprisoned, etc. They don't have to prove that it was intentional. Fraud can range from an individual or single practitioner to a group of people or a practice group to an institution and corporation. Fraud can span across a large array, and many people can be held accountable for that fraud. The chapter goes into Medicare abuse and what it means. CMS Fraud Prevention Initiative. So the past few years, CMS has implemented tools to shift from a pay and chase approach to a prospective approach. We pay prospectively now, and that looks to prevent fraud and erroneous billing. Law enforcement partners also work with CMS to detect and prevent fraud. The success of programs like the Fraud Prevention Initiative can be measured in dollars. And so for every dollar spent, there's a $3 in savings in the first year of that program. Also, Medicare has redesigned the Medicare summary notice, makes it easier for the beneficiary to spot fraud and errors. Because we actually, as healthcare consumers ourselves, we have a responsibility to keep an eye on fraud. But I'll get to that in just a minute. CMS has also started a campaign called Help Prevent Fraud, which educates people how to protect themselves against fraud. This education includes telling people to never give out their Medicare number, which just happens to be their Social Security number, unless that person is authorized staff who would actually need that number. Just want to be very protective of any kind of healthcare information these days. Next section of the chapter is Healthcare Fraud and Prevention and Enforcement Action Team. HEAT is the acronym for this. It is a joint initiative between the Department of Health and Human Services and the Department of Justice. So again, trying to do better for the people, but there's also criminal, not responsibilities, what am I trying to say? Criminal, you can get charged criminally. I can't think of the word I'm trying to say, you guys, I'm sorry. So the HEAT team they're responsible to gather resources across government agencies to prevent waste, fraud, and abuse in the Medicaid, Medicare programs and reduce the skyrocketing healthcare costs. So that is the ultimate goal. Bring down the cost and serve the people better. It is criminal activity if one does commit fraud, whether it is that joint person, whether it is a large entity such as a hospital, whether it's a private practice with 2 or 3 practitioners. Anyone involved can be charged, fined, imprisoned, penalized with criminal activity. It is a big deal. The chapter goes into the Zone Program Integrity Contractors, the National Benefit Integrity and Medicare Drug Integrity Contractor. Then we get into Medicaid fraud and abuse laws in the chapter. This is a big deal. You do not want to intentionally or unintentionally abuse Medicaid, Medicare. You want to follow the laws. Stark Law is mentioned, the False Claims Act, Anti-Kickback Statute. You'd be surprised. I've been in healthcare 23 years, I think, almost now. And I recall in the very beginning certain things being done or said or ordered, and it was like you could have said it was a kickback. I didn't know back then. I was a very young, brand new nurse, but I could see how I understand why these laws are in place now to protect people and to prevent the skyrocketing healthcare cost. The chapter continues. So here on page 193, this is the top 10 ways consumers can help fight Medicare fraud. And basically it comes down to protecting your information, reviewing dates and claims. We would never want our consumers to go to a doctor's visit, not keep up with it, and not read the explanation of benefits from the insurance company to see what was paid. We want those people to know what was paid, what was not paid. And incidentally, if you receive three EOBs and you only went to the doctor once that month, that's a red flag. There's somebody's either using your identity or the office is committing fraud. So you always want your consumers to be heightened awareness consumers and keep a check on those type of things. False Claims Act is on page 194. U.S. Code sections protect the government from being overcharged. So again, something that has criminal repercussions. We have to be really careful. The chapter continues with the criminal healthcare fraud statute. It is found in 18 U.S. Code section 1347 and prevents knowingly and willingly executing or attempting to execute a scheme or to defraud any healthcare benefit program by means of false or fraudulent pretenses, etc. Proof of the intent is not required for someone to be charged criminally with this. Chapter continues into the anti-kickback statute, physician self-referral law. Exclusions. Exclusions are important when it comes to federal health care programs. When a provider is excluded from all healthcare programs, federal healthcare programs, the provider cannot receive any payment for any items or services furnished by the excluded person, nor can services be provided at the direction or the prescription of an excluded person. The excluded provider, since they are unable to treat patients, they may refer the patient to a non-excluded provider if the excluded provider does not furnish, order, or prescribe any services for the referred patient. That's a lot. That's on page 195. I'm going to keep going. A violation of the OIG. So this is important too. The excluded person may be also subject to an assessment up to 3 times the amount claimed. So if a provider has been excluded and lands on that excluded list and does submit for a claim to collect monies, they can be assessed 3 times the amount of that claim as punishment. So, what about this list? Page 197, it talks about determining if an individual or entity is excluded. There is actually a website for this where you can go to a database and look up the name of a person, what type of provider they are, the state where the excluded individual resides, and mechanism to verify whether with their employee identification number, social security number, if they are on the list. And the OIG intent is to soon update the LEIE, which stands for List of Excluded Individuals and Entities. So they update this. They want to keep it updated because we, as healthcare facilities, healthcare providers, healthcare offices, we should be checking that list not only upon hire, but frequently, more often than one would think. And they talk about that on page 198 under frequency of screening. To avoid any potential liability, providers should check the LEIE before contracting or employing a person, and then periodically check the list against the current employees and contractors. It's not mandated by the OIG to do that, but that's just good practice because you want to know. You want to make sure that your newly hired provider, or even somebody that's been around for a few years, is not on that list. We'll keep going. Page 199, physician self-referral. Great information there. Self-referral disclosure protocol. The CMS disclosure protocol enables providers of services and suppliers to self-disclose actual or potential violations of the physician self-referral statute. Now, the self-referral doesn't necessarily lessen the consequences, but you are allowed to do that. Then it goes into descriptions and findings, what that can mean. Physician compliance program is basically a guide that promotes adherence to statutes and regulations applicable to the federal healthcare programs. Got to have something because there's so much information with healthcare finance and especially fraud and abuse. So the guide is great. There's 7 components. You can read that. Page 201, establish practice standards, whether you're doing internal audits in your office or your practice. Make sure you have written standards and procedures. If any fraudulent activity is identified, you're going to want to make changes to make sure it doesn't happen again, figure out how it happened, why it happened, and how to prevent that. The chapter continues. Oh, and then we're at the very end, page 202. So in conclusion, healthcare administrators need to be the experts with fraud and abuse. There's lots to learn. Fraud and abuse can place strains on the finances of healthcare. If it comes up once, the healthcare administrator needs to be able to immediately identify the problem, isolate it, assess the error, and come up with a documented plan to correct it. You're going to report it, and then just that healthcare administrator is going to keep on being the expert. They need to know the actions that involve Medicare fraud and abuse.